What is medical ethics? Well, ethics is a study of the shared and competing values that are held by patients, physicians, and society. That doesn't really seem like a very helpful definition, but medical ethics can provide the physician with a structured approach to resolving some very difficult situations that occur with patients. In philosophy, ethical behavior is what is considered good or right. Now, how would we know what is right? The components of the doctor-patient relationship have to be thought about very carefully, particularly because the patient is vulnerable, the patient is ill, and the physician has greater education and knowledge and therefore is placed in a position really of power in relation to the patient. And we also realize that the physician can engender trust and confidence in the patient as a result of this sense of power and this relative relationship due to their ability to diagnose and treat. So patients have trust and confidence in us, and we need to be careful with regard to how we utilize that in our interactions with patients. The relationship between physicians and patients has evolved over time, and it does very much depend on the characteristics of the patient and the physician. I've cared for patients from other cultures in which I tried to provide the patient the process of informed consent, and patients from other cultures will feel very uncomfortable and come back to me saying, I don't want to have decision making, you're the doctor, you should decide for me. That is an uncomfortable feeling for us because in our culture in the West, we have evolved a sense that patients should be autonomous and able to decide things for themselves.